Hello and welcome to Tell Me More. For today's episode, I'm joined here by Dr. Pablo Galindo, and we will be discussing sinus lift complications. Thank you for being with me here today. Now, my first question is with regards to the most common complications that you will see after a sinus lift procedure.
So, good afternoon, Hailey. According to the literature, the most frequent complication that we are going to have in this kind of technique is this sneridian membrane perforation. And this is not only one intrasurgical complication, but normally happens when we are working with the patient, just in the surgical room. But even solving this kind of complication, we are going to have another consequence in the long term of our implant if you do the perforation. So this complication is really important to take in consideration, not only when we are doing the procedure, but also later. Okay,
so let's focus now on firstly on the early complications that can occur. What would you say they would be?
This complication in the immediate moment is really important because, if you don't solve the situation when you place your biomaterial, the biomaterial is going to do emigration inside the sinus, and you are going to guarantee an acute sinusitis for your patient. So this is really important. If you have something with movement inside the sinus, you are going to have pathology, and this is going to promote the failure of all the technique. Not only the technique itself, also all the biomaterial and implant that you are placing in the same time, if you are able to do that, if you do in one stage. So this complication is important to manage, and the final result that you are going to have, not only in the short term when you are having the healing of the patient, but also in the long term is going to be totally different. So how to manage this complication is really important.
And what about, maybe hemorrhage or other kind of issues that you may have?
Hemorrhage is a very interesting complication that we have, but we have two different stages of this kind of complication. The first is to consider that we have normally not a big arteria, the anastomosis, the arterial anastomosis in this area, the posterior superior alveolar artery. But it's not a big arteria, but when you have the bleeding, you have a double bleeding because it's anastomosis. So it's difficult to manage, it's difficult to place the biomaterial. You are going not to have a good vision of the surgical field, so it's going to be all totally complicated. So it's difficult to manage. But if you do a good pre-diagnosis using the combing CT, you are able to measure the location and the diameter of the arteria, you can solve this kind very, very easily. But this is the intrasurgical complication. Later, when you control this kind of complication, you can have also some hemorrhage or chemosis of the patient if you have bleeding of the little vessel that you have in the sneridian membrane. So people think that if they do just crestal technique and they are not doing lateral technique, they are going to preserve the complication because the anastomosis is in the lateral wall of the bony wall. But people think that with the other technique, they are not going to have bleeding, but they can promote the perforation of the sneridian membrane, and the sneridian membrane are able to bleeding by per se. So this is something important to take in consideration.
So what factors would influence your choice, for example, between open and closed sinus lift?
There is a very interesting discussion in the literature. The classification of sinus is going to give you more or less the different plant treatment according to the quantity of remnant bone that you have in the alveolar prosthesis. But when I do surgery, I prefer to take control of everything that is happening, and visualization is really important to me. So although I have enough quantity of bone for doing crestal technique, I prefer to do lateral if it's possible because it's not very time consuming, it's easy to do, it's quick, and you can ensure that you are not have a lot of complication that you can have with the transcrestal if you are doing lateral. People think that they are doing transcrectal, they have no problem because they put their head in the floor, so they are not watching the complication. But this is in surgery. This is sometimes a real problem. So I prefer every time that is possible to do that, to do lateral windows in order to have a good vision. If I'm going to have any complication with the arteria because it's very big or it's in the middle of the surgical field, whatever, we can do the other technique. But if possible, I prefer always to do lateral.
You mentioned bone grafts. How common are bone graft failures?
One of the advantages that we have in the sinus is that almost all the biomaterial is going to work adequately. So, and it's quite interesting because our group, they did many research regarding that, using all the families of biomaterial and combination of them that we have in the industry with this, for doing this kind of procedure. So it's amazing because all the biomaterial is giving you more or less exactly the same quantity of new vital bone for placing your implant and have a good osseointegration. I have to say that this quantity of final new bone formed never is better than the bone that you have in your own area. It's impossible to have superiority using something that the area that you are going to do the rehabilitation. So inside the sinus, almost all the biomaterial behave in a very important way or in a good way because it's surrounded by a very osteogenic cavity. And this is also amazing because this is a very wonderful area for doing research in human, because when you do this technique in 2 stage, you can place any biomaterial, and as you need to place an implant, you can take a sample with the trifine in the place that you are going to place the implant, and you are able to analyze what's happening with the biomaterial in human. That is the biggest and better model for doing research regarding biomaterial. And we are able to take many information regarding the maturation of the bone, not only for applying dentistry, but also in all the economy of the patient. And this is really interesting for our techniques.
What about the implants and any implant movement? Can that have an effect as well?
This is a very important point because it's becoming every single day a little more common complication, because people think that this technique is easy, but everything has a learning curve. So many of the people prefer to do transcranial technique in order not to do lateral, and they think that the implant is going to have enough primary stability. But the spatial composition of the bone in this area promote a different regeneration in the implant, and some of these implants are not going to heal so well as we think that is going to happen. And we have just migration of this implant in the long term, not in the day that you are placing the implant. If you have the migration when you are placing the implant, it's easy. You go, you take the implant out, and you continue doing the procedure. But mostly, this kind of complications coming in the long term. And this is because we don't consider the anatomical and the histological component that we have in this area when we are placing the implant.
So you mentioned the late complications. I mean, what potentially could they be?
Normally, the most common complication in the last time, in the long period, is to have chronic sinusitis. This is going to affect not only the life of the patient, but this also is going to affect the implant survival per se, and for sure is going to promote the retrograde resorption of the biomaterial. So your technique is going to be worse if you are doing this or you are having this kind of problem. But chronic sinusitis is something that we need to consider in our patient. And normally we need to treat this patient very carefully because this can do a life-threatening complication for the patients.
What about using short implants as a solution to a sinus lift?
A short implant is becoming a good solution in the last time for doing any kind of rehabilitation in the atrophic maxillas, not only the upper but also the lower. Now when we have a few bone, not a big quantity of remnant alveolar crest, at least 6 millimeter, we are placing this type of implant without doing sinus augmentation. So literature is totally consistent now when they are doing comparing studies regarding sinus augmentation or short implant, and results are exactly the same or quite similar. So they are becoming a very good solution for those patients that have not a lot of bone, but enough for placing this kind of implant.
In your session earlier, you mentioned the actual form of the sinus and how that might need to be taken into consideration because it is different from person to person. What are you looking for, and how would that impact any kind of planning?
The anatomy of the sinus is really something that you have to consider before placing your implant, because there is several factors that you have to consider. If the patient is a dentate patient, the lateral wall is going to be very thick, so the technique is going to be a little more complicated. The perforation rate is going to be higher. if the patient is a younger patient that has a lot of, a huge quantity of bone, literature is very consistent, explaining us that the longer is the distance between the lateral wall and the palatal wall, the higher are the complications. So as the patient are coming older, this is really interesting because people and literature say that when the patients are coming older and they are edentulous, the sinus is going to be bigger, but the reality is just the opposite. When the patients are getting older, all of us, we have one height when we are younger people. When we are older, we are a little smaller, and we are reducing our size. And with the sinus, it's exactly the same. When we are treating old patients, they are going to have less quantity of bone, and the distance between the lateral and the palatal wall is going to be less, and the sinus is going to be a little more plain, not with the U shape, and this is going to avoid complication. So anatomy considerations are really important when we are facing the technique.
Just to conclude, what takeaways would you like to give to anyone watching to avoid any sinus lift complications?
To me, sinus is a very, very indicated technique in the atrophic patient because it's an easy technique to do, it's easy to conduct. If you have the adequate learning curve, you are going to be able to solve atrophic patient without going to more dramatical technique. And you are going to be able to place implant in patient with a few quantity of bone, solving the life of the patient and giving a huge quality of life to this patient. But in the same way, although the predictability of the success of this technique is very high, yes, over 90-95%, that is something unbelievable in medicine. When you are placing this or you are doing this technique, you cannot think that this is a sense of complication. So the most important complication is for sure that we need to face is the avoid the Schneider membrane perforation, because all the other complication is quite associated to this one. Not also the intrasurgical complication, the most important factor, because we cannot forget that the sinus augmentation is a technique in order to promote the bone formation where you are going to place implant that had to be prosthetically driven, working the patient for a long time. If you are losing your implant, you are losing the aim of the technique. So all these other complications is going to diminish the survival of the implant, and that's really important. So the main complication is beginning with the Schneider membrane. So it's an easy complication to solve, but if you don't that correctly, you are going to be with trouble at the end of the life of the implant in the mouth of the patient.
Thank you very much.
My pleasure. Thank you very much.